Mount Sinai's biggest wish for our community is that everyone is able to achieve their healthiest status, whatever that means for them. Health of body, health of mind, and health of spirit. Hi, I'm Mitch Balk, and it's my privilege to serve as the president of the Mount Sinai Health Foundation. As a Jewish-sponsored organization, Mount Sinai is very aware of health disparities, of oppressed communities, of communities that have traditionally been marginalized in healthcare and beyond. The Mount Sinai Medical Center was founded in large part, like many Jewish-sponsored hospitals around the country, because there were specific needs of the Jewish community that needed to be met in the healthcare space. In particular, Jewish doctors-to-be could not train at other hospitals, and they could not get staff privileges at those hospitals when their training had concluded. So this is why Jewish hospitals in general came into being. In terms of Cleveland's Mount Sinai Hospital, it came into being in 1903 and existed for nearly a century, serving the community. The Mount Sinai Health Foundation was born as a result of the 1996 sale of the Mount Sinai Medical Center and related operating entities of the Mount Sinai healthcare system. The foundation's 4 grant-making areas of focus all reflect the mission of Mount Sinai Medical Center. The health of the urban community, because Mount Sinai was a safety net hospital for the east side of Cleveland for those marginalized and for low-income folks. We are very focused on primary prevention and early intervention. Both the head and the heart would compel us to direct our efforts in this way. When you talk about a prevention strategy in the urban community, you are of course drawn to the maternal child population and to the prenatal period in particular. And we are so pleased that we have played a large role in bringing nurse-family partnership, a nurse home visiting program for moms and babies prenatally to age 2, to Cleveland for the first time. The evidence base is very clear. For the babies, 60% less likely to ever be involved in the criminal justice system or the juvenile justice system versus their peers who did not participate in nurse-family partnership. We are also very proud of the fact that for the first time, we got the federal government to provide MICV funding, maternal, infant, early childhood home visiting money, to support this program. Never been awarded in Cuyahoga County before. The health of the Jewish community, our founding constituency. In the Jewish community, which is so respected and planful in terms of meeting the needs of its members, we were very honored to be approached by parents whose children were diagnosed with autism spectrum disorders. We went to Belfair, and together we paid a visit to the Eden Institute in Princeton, New Jersey, and went to school on that model. And the result was the Monarch School, our region's first school for educating kids with autism spectrum disorders. We went on to found the Monarch Boarding Academy at Belfair for kids who could no longer live at home. It's not about improving health status, it's improving quality of life often, not just for the individual, but for the family that cares for that individual. Academic medicine and bioscience, because Mount Sinai was a teaching and research medical center, in fact, a first-tier community teaching and research medical center. One of the proven investments that philanthropy can make is a junior investigators program to help launch the careers of young scientists, bioscience research stars, here in Cleveland at the Case Western Reserve University School of Medicine. We have done this over many years, recruiting more than 20 such scholars, and from our $10 or $12 million investment, we have seen the leveraging of more than $80 million in National Institutes of Health research funds to be spent to be used right here in Cleveland. And finally, the fourth area of our giving is health policy work, because we recognize that it is government and not philanthropy that has the biggest role, it has the biggest lever. Cleveland's lead poisoning problem has long been recognized. It is truly a community tragedy, robbing our youngest and most vulnerable children of their promise. And so we, along with now 500 individuals and entities, have founded and now operate the Lead Safe Cleveland Coalition. This coalition ensures that rental properties in Cleveland are declared lead safe before they can be least to a family. And we hope to reduce the percentage of kids with lead poisoning. We are very intent on having measurable results and a measurable impact in each of our grant-making areas. We need to align ourselves with the changing needs of the people of Greater Cleveland. And we are also lucky to be in the opportunities business, not just the needs business, so that when we see opportunities to improve health, that when the stars align, whether that be in Cleveland, in Columbus, in a neighborhood, that we can jump in and be the catalyst for making important things happen.